சும்மா சுத்தின்னு இருக்குது இப்ப. இப்ப லைவ்ல வந்திருக்காங்க. ஓகேயா? என்ன பண்ணலாம்? Can we start or you sure? உங்க ஆளுங்க டிக்கெட்டியா? Have you spoken to your ah, okay, okay. I'll cut the call and I'll start talking, right? Okay. Good evening, friends. It's a great pleasure and a privilege to connect with you on this live platform. Um, I would I would like to say that it's a privilege and an honor and a pleasure. And the pleasure of talking to you is to a great extent, I think, diluted by the fact that we are locked indoors and we're not able to do the many things that we need to do. We are in very distressing times, which are pushing us to the limits of our patience, our logistics, our economics, our social framework, our finances. Just about everything, I think, has gone for a six over the past 2 to 3 weeks. I think what this has really helped us understand, at least what I have understood from this is that life has always been a battle between nature and the livestock paradise that we're looking at. So nature versus conservation has always been the equation in which this world has survived and survived for thousands and thousands and thousands of years till this guy called man put his foot on the planet. Till this guy called man put his foot on the planet, and I think the whole thing went for a six since then. Whether you want to believe Darwin, who says that we came from the monkeys, or you want to believe in something else, the very fact does remain that the minute man put his foot out here in the planet, he started this great process of what we today call as degrading this planet, making this planet unlivable. So I don't know if the days of the dinosaurs were better than the days that we have now. It was a very equitable framework in the days of the dinosaur. They had their segments and lived in them and did not encroach upon each other's territory. But today, the first thing that we need to do is to try and impinge on somebody. And I think that's one of the basic facts that I have learned. And I think almost everybody at a philosophic level, given all the problems that we are now faced with this, I think we've understood for ourselves. It just needs a minute of retrospective thinking to put it in perspective. So we understand today that the COVID is a new type of virus. And it's not a new type of virus. We know that these coronaviruses have been with us for a long time, be it the SARS or be it the MERS or being other viruses like Ebola. We've seen everything and we are seeing this. And there are some peculiarities to this, though there is, I won't say there is anything to panic as such, but I think the one thing that we're really worried about is the speed with which the numbers are going up. And I think that's extremely important. The speed gives us this innate fear as to whether we are dealing with anything other than droplet transmission alone. And I think that worries us to a great extent. But whatever said and done, I think the best thing today to do is to isolate yourself as much as possible, is to wash your hands as much as possible, wear a mask, and even the indications for the mask keep changing every single day. And then please look into the WHO and the ICMR, which will tell you that today is you need to wear a mask, or today you can take your mask off. And I think that's what ICMR will tell you. But I think what is a more and greater concern, I think, is the concern of people with specific diseases. And I think that is what is important. We have now learned that younger people are probably lesser affected. older people who are more than 65, 70 years with comorbid conditions like diabetes, hypertension, asthma, COPD, interstitial lung disease. And these are people who are having it really bad when they do get infected with this coronavirus. And I think they're really getting the wrong end of the stick in such situations. So I think the next 20 minutes will be spent in trying to reassure them about certain level, I won't say myths, but certain misconceptions that they may have about basic virus by itself, and also the fact that it does hit the respiratory system, and we all know that we have to live with it. Now, as I said, looking at the virus itself, we'll not go into the biochemistry, and we'll not go into the physiology of this virus, but we will just make a comparison with SARS and MERS, which we have known firsthand over the past 15 years. 90% of us have seen the SARS and the MERS, and we know what we're looking at here really. And we fully understand, and the H1N1 as well, we fully understand that these are things that have caused mortality. Number one, your COVID 19 also causes mortality, number one, but the COVID 19 mortality is significantly different and significantly lesser than the mortality that is being caused by the other viruses. And I think this is something that every single person must keep telling himself constantly, whether he turns into the news and I think is baffled by what they tell him on the news. The best thing I would say is please don't look at this television morning, afternoon, and night. Just once a day, tune into the television, open down, then look at something else. Because I think 90% of the television that you see is just repetition of whatever they've been saying again and again and again. And when you hear the same thing again and again and again, you tend not only to believe it, but then to think that it's the gospel. It may not be the gospel, it may not be the absolute truth, it may be something close to it, but then we need to decipher and do a lot of teasing in between. So, my first suggestion, if you're going and looking at the television, is don't do it 24/7. Just have a peep into it and look into the other many things that you've not looked into, including possibly the Cartoon Network that we're looking at. So, I think that's one thing that I will say, ask everybody else to do. The other thing is that all of us would have had many types of likes and dislikes, reading books, looking at other things, trying to enhance ourselves academically and things like that. I think this is a time for trying to do some things that we cannot do and we have not done over the past 15 to over the past so many years. And I think we need to indulge ourselves in that. Now, coming to this basic portion of this, two things are quite obvious. Number one is that this virus has got a lesser mortality than the SARS and the MERS. That's a point that we will close out. Number one. Number two, I think the most difficult thing about this virus is that the incubation period we are not really sure about at all. With the SARS and the MERS, it was quite a short incubation period, and if you didn't really fit into it, you were fit to go. But here, even 15 days, I think it's a very poor way of looking at the incubation period. And also the onset of symptoms. If you look at the onset of symptoms, it's going a little haywire. Some people have fever first, some people have body pain first, some people have cough first, but then most of them have at least two or three of the following: fever, body pain, cough, and then breathlessness. Somebody asked me about fever, body pain. I think a fairly easy symptoms for us to interpret, but breathlessness will always be difficult to interpret, especially if you're an asthmatic or if you're a person with COPD who has experienced breathlessness in the past. And then the first question you will ask yourself is this breathlessness that I have, is this related to my old existing condition like asthma or COPD, or is it something else? And I think this sometimes could be a very difficult question to answer for yourself. So I think the first symptom with breathlessness must be, I think you need to compare the level of your activity causing the breathlessness with what you had maybe 15, 20 days ago. 20 days ago, I was able to climb one flight of stairs. Today, I have to stop on the fourth step, fifth step. And if this happens on a consistent basis, I think you're having a problem. If you're able to walk from lamppost A to lamppost B without a problem, then it's fine. But now after the onset of these symptoms, you're able to do only half that distance, we know that we're looking at a problem. So I think the relativity in terminology is the one that really helps you to understand the level of the so-called breathlessness symptoms that we are talking about. You can go by the set of scores, whether it's the British score or whatever score on breathlessness. But I think, as far as I can say, to a patient, if you are not able to do what you were doing maybe 10-15 days ago, and you have an accompaniment of these symptoms, I think you need to take cognizance of the fact that this could be a problem, and you need to look at it. So the breathlessness, even though it is a vague terminology, we don't need to be afraid of it. We can always interpret it, and the interpretation will always mean that you look at an exercise that you've been doing before, which you're not able to do now. And I think that is important. The other thing would be the accompaniment of other symptoms like cough, for examples. Generally, we have seen that asthmatics who are COVID cough probably a little more. They have more sore throat and they have more breathlessness. And these people are clearly say people who need to be tested as quickly as possible. One cannot, I think, reinforce the reinforce enough the need for testing, and more testing, and especially patients who have multiple disorders, especially related to the respiratory tract, like asthma and COPD and interstitial lung disease. I think if they do have these small set of symptoms like cough and wheeze, it would be rather better to examine these people and try and find out, take a throat swab. And as far as the swab is concerned, I think it is very important for us to know that there is a very clear technique. It's not just sort of swabbing the posterior pharynx or something like that. There is a very important technique that you need to undertake when you take the swabs. And number two is that the person who takes the swab must need personal protection equipment, because you're very likely to sort of sneeze on him or cough on him or something like that. So I think those things are necessary. When you do the swab, think not only about yourself, but also think of this person who's taking the swab. So it means that there is both an initial selfish and a sort of community awareness, as we'd like to take that. Now, we are not very sure about this rapid testing. It's like the wolf that finally came. We really don't know when the wolf will come. But the fact does remain that if you do we've always felt that all these antibody testing that we've seen have not really helped us in the past. The TB antibodies, for example, have gone for a 6 today. And though this may be a sort of community tool, a tool in the community to try and tell us that there is this fraction as such, and it's probably cheaper and you get the results faster. But I think the gold standard that we've set for ourselves today is the swab, and we need to go by the RT-PCR that we're really looking at. So I think these are some basic things that we need to understand. The other thing, of course, I would be failing in my duty if I didn't talk about the mask. The mask is something, again, you look at the ICMR for the past 15-20 days, you will find a lot of back and forth on the mask. Patient should wear a mask, relative should wear a mask, the guy on the road should wear a mask. There are a lot of things as such, but I think it's very, very simple. The more severe you're infected, you wear a mask. That's the first thing. We'll go from top to bottom here. The more severe you're infected, so if you're COVID positive, a mask is an absolute must. One. Two, if you are close relatives who are looking after you and you are COVID positives, the relatives need to wear a mask too. These two things are absolute non-compromisable entities, and these are two clear varieties that you need to use a mask to. Now, if you're going down for a cup of coffee, whether you need to use a mask or not, the concept on this has changed for a long time. Today, because there is this fear of what is called airborne transmission, people say that it's better to use a mask whenever you go out, though the real picture of whether it produces more reassurance than protection is something that we need to understand for ourselves over a period of time. So at this point of time, when you go out, do wear a mask. Um, because I think if you don't wear a mask, everybody who sort of looks at you will look at you very differently. as though you've descended from Mars or something like that. So please wear a mask and feel comfortable. And whatever whatever it is that we are looking at, I think we are looking at a difficult sort of situation as far as these masks are concerned, and that's something that we need to understand. So I think we'll come to this basic stuff um, with about 2 minutes on the so-called preventive prophylactic things that we're really looking at. So there is no prophylaxis for COVID-19. Double underline, and I think so be it at this point of time. This sort of instruction from the ICMR may change even after 2 minutes from now, but for the current point of current nature as such, there is no prophylaxis. The first line treatment that they give for these patients is to get them, if you're COVID positive, is to get you on azithromycin and hydroxychloroquine. Those are the two drugs that we use. We should understand that hydroxychloroquine has a lot of cardiac rhythm related disturbances. So people who have altered cardiac rhythm, like patients with atrial fibrillation and the rest, I think we need to be very, very cautious. Patients with heart block, we need to be very cautious about the use of this drug, and they need to be monitored extremely closely. And I think it's important to do that. They did talk a lot. The other drugs that they generally use are, of course, the lopinavir and the retinavir and things like that. So, word on the respiratory function and the respiratory investigations that you can do. The chest X-ray is an absolute must in these patients. There are many situations where if you get a chest X-ray which appears normal to you, and you have a patient who is symptomatic, who is breathless, whose PO2 is going down, whose simple pulse oximetry is down, and is feeling short of breath, the first thing that you'll have to think of is a viral pneumonia and go for a CT in these patients. It is very important, even if you're going to overdo the CT. I'm not saying that we should use the CT as a means of investigating and diagnosing a COVID-19, but if you have the background, I think a CT is important because the CT has very classic features. It has got ground glass appearance. It has got a bit of a tree in bud. It is the peripheral. It is sort of distributed all over, probably more basal. Um, there also could be a bit of traction bronchiectasis and ground glassing. And these are important things that you'd really look at in the CT. And the CT will tell you whether there is a tendency for viral pneumonia at all or not. And after that, you have this as such. So once you get the viral pneumonia, I think it depends on whether you're going to get better or not. There are a lot of patients who have recovered just with azithromycin and hydroxychloroquine. And let me please tell you, ladies and gentlemen, that we are not sure as to whether they recovered by themselves, number one, or whether they recovered because of the hydroxychloroquine and the azithromycin. So they have recovered. I had a patient of mine who had come back from Paris, and this chap called me from the airport. Though that was the last day the way the people were let in to the airport as such. So he managed to beat beat the UV recording of his fever. He landed with the fever, and he came and told me, I've been having fever I've been having a cough for the past 20 days, and I'm here. So I started him on some azithromycin, and I told him, please lock yourself up and keep yourself. He started deteriorating in about 48 hours. We sent him to hospital. Um, the first day itself, with the chest X-ray and the CT, we really found a viral pneumonia. And after the viral pneumonia, his first PCR was negative. And I think this is something that we need to understand. We have many patients, when you start off, they start off with a PCR negative. His second PCR, done after about 4 or 5 days, was positive. And then, of course, he was discharged a couple of days ago, before his discharge, we had two PCRs which were negative. And this was a 46-year-old guy with just diabetes and hypertension, that to borderline reasonably conscious, a bit obese, but otherwise there's nothing else. So I think this is something that you need to keep in mind. The fact that the first PCR may let you down in the second PCR is probably something that you will have to do. So you look at asthmatics, for example. I think we'll finish off with the asthma first. What is most important in an asthma? The most important thing in your asthma is number one, to make absolutely sure that you continue to take your asthma medicine. And if you look at Medscape today, even today, there is an article from the Lancet that talks about asthmatics needing to continue their inhalation therapy, be it the inhaled corticosteroids or the long-acting beta agonists or the combinations that we use very commonly. Please make sure that your basic problem is under control. Let not the word steroid there, the inhaled steroid there, really trouble you, because we fully understand that the inhaled steroid is not like an oral steroid, and we need to know that people who are taking steroids must not stop. If you stop, you're putting yourself at a greater danger of developing any sort of infection. COVID 19 is just around the corner. And I think it is important for you to do this. So, the first thing that I will advise you is that if you are on long term medication, which I hope you are, if you're an asthmatic, you need to go back to your medication and take it full dose at least for about 4 to 6 weeks. And once you start that you're feeling better, come back to me. There is again, we cannot overstress the point that you need to have good inhalation and inhaler technique. Make sure that your technique is normal. If you're not quite so sure, get it checked with your doctor. You can go online and get a visibility and ask your doctor to make sure that you're using the inhaler properly, be it the dry powder or be it the MDI or be it the breath actuated inhaler, whatever you're taking. Please make sure that you take your doses regularly, and please don't be offended by the word steroids. Steroids are not a problem. Those steroids are not treatment for COVID 19 by themselves, except in very sick patients where you have nothing to do, where you have hypotension, where you have a lot of other issues. Maybe you can use a small dose of steroids, but by themselves, oral steroids are not a problem. So, what happens to people who are on oral steroids? And I think that's again important. If you're an asthmatic and if you're on a small dose of oral steroids, because you have a very severe asthma, the best thing would be to continue to use your oral steroid and keep you at that dose itself. Please make sure that you don't stop your steroids, because these people are long term, probably steroid dependent. And the minute you withdraw the steroids, your immune status starts going down. Then you become a very prime candidate for a COVID 19 infection or any other type of infection that we're really looking at. So I think it's important for us to realize that those people on the steroids need to continue their steroids and make sure that they take their medicine. Suppose you have rheumatoid arthritis and you're on 2.5 milligram of oral prednisolone, you have an interstitial lung disease as well as that. So I think you need to continue that small dose of steroids that you're taking and be comfortable with it. So asthmatics, very important that you continue your therapy. Make sure that you pay very good attention to the so-called breathlessness that I spoke to you about. And then if you think that you're getting any of these early symptoms, especially like cough, fever, and breathlessness, and I think it's better you go and consult your doctor. I would err on the side of doing the RT-PCR much more for these patients who have primary respiratory disease like COPD and asthma. Whatever I said for asthma, I think applies to COPD as well. It is all the more important in COPD and all the more difficult to look at COPD exacerbation, because COPD patients are always breathlessness, and sometimes it may be difficult to perceive very early as to whether you have an extra breathlessness on top. And I think the bottom line in both these patients, please take your medication properly and make sure that your medication is taken and supervised properly. And I think it's important to realize that that is your best protection. Wear a mask as often as you go out. Try to wear a mask at home. Preferably try to avoid going out. Try to stay indoors. It is excellent to sort of isolate yourself, and quarantine I think is a wonderful concept. And this concept of quarantine, I think over a period of time, has already enabled us to sort of flatten this curve of the increasing COVID numbers that we're looking at, and then go ahead in these patients. But if you do develop symptoms, please make sure that you go and check with the doctor and make sure you err on the side of doing an RT-PCR than otherwise in these sort of things. If you have a peak flow meter, I think that's something that you can put to good use, especially if you're an asthmatic. If you're a COPD, it may not be of great use to you. But if you're an asthmatic, a simple peak flow that you use at home could be a good device to tell you that you have breathlessness, more breathlessness, or less breathlessness, depending upon the values that you see here. So I think, ladies and gentlemen, what we have seen so far is that we are living in very difficult times. There is no question about it. We are living in difficult times, times that we have never seen before in our lives, times that we have never experienced, times where everything is in limbo, times where everything changes by the minute, minute by minute. You find more recommendations, more people telling you all sorts of things. So I think it is important at this point is to hold your balance. So please hold your balance and always understand that humanity over a period of time, nature as such, has a set of dealing with these problems. Otherwise, we won't be where we are. We would have sort of got lost with the Ebola and the SARS and the MERS and all those things that we have had in the past. And I think whatever happens to us, both in the past and in the future, the very likely cause of that is us and the way that we have conducted ourselves in this world and the way that we have tried to alter this world, the fact that we have deforested and more than 40% of our forests, 60% of our forests have gone. So the whole the ozone layer is gone for a six, and there is so much of climate change. So naturally, I think you find elephants and um, elephants and tigers get onto the road because they don't have water to drink. They don't have a habitat. Their habitat is being invaded. So you invade somebody else's habitat. Somebody is going to invade your habitat. And that somebody today, ladies and gentlemen, is the coronavirus. And please understand that the next huge catastrophe that we will face is not the atom bomb, is not the tsunami, is not the Third World War, but I think it is something like this very minuscule, invisible virus that kills and kills very specifically, that can really turn our lives upside down and reduce the meaning with which we look at things. So please stay safe, ladies and gentlemen. All of you, if you're asthmatic and COPD, please make sure that your medication is intact and you're comfortable and have faith, because faith is like a rope. And the best way of taking faith is to tie a knot at the end of the rope and hold on. Holding on to what we have today is probably the best thing that's going to take us through this phase. We will get a vaccine sometime, but God knows when. So please stay safe till that time arrives, and take care of yourselves and take care of your medication and take your medication well as well. Thank you very much, and God bless you all. Hello, hello, hello. தம்பி முடிச்சாச்சு ஏதோ கொஸ்டின் வருமா இப்ப? சரி. I'll wait, no problem. Thank you. Right. சொல்லுப்பா. ஒண்ணும் இல்லையா? நான் க்ளோஸ் பண்ணிடுவா அப்போ. க்ளோஸ் பண்ணிடலாமா? சரி. எண்ட் லைவ் வீடியோ போட்டுறேன் நான், அவ்வளவுதானே? ஓகேப்பா, ரைட்டு. தேங்க்யூ தம்பி. ரைட்டு.